Extensive COVID pneumonia is one of the few causes of mortality and sudden death in a COVID positive patient. But unfortunately, patients will not have any symptom at the earlier stages of COVID pneumonia. So it is very important to have high index of suspicion in COVID positive patients for COVID pneumonia. So is there any relevant clinical test, relevant investigation to find out earlier stages of COVID pneumonia? The best test is computerized tomography, CT scan of the chest. But unfortunately, when tens of thousands of people are in home isolation for COVID treatment, we cannot do all the patient, we cannot subject all the patient for CT scan chest. So is there any clinical relevant test to detect early stages of COVID pneumonia? Yes, it is our 6-minute walk test. 6-minute walk test is a predictor of early involvement of the lung parenchyma. So the principle behind the test is that when we subject any person for some sort of physical exertion, the oxygen demand increases. The heart will start pumping at a faster rate, heart rate increases. We'll breathe out very fast, respiratory rate increases. So much so that the oxygen content of the blood during exercise will remain more or less the same. To increase oxygen content of the blood, according to the demand, we require a normal lung for gas exchange. So, suppose in the early stages of COVID pneumonia, when some part of the lung is affected, when we ask the patient to physically exercise, what happens is that because some part of the lung parenchyma is affected, the heart rate may increase, respiratory rate may increase, but to increase the oxygen content of the blood, we require full normal lung. Because some part of the lung is affected by COVID pneumonia, what happens is that the oxygen content falls disproportionate to the requirement. This is the basic principle in 6-minute walk test. To do the test, it is very simple. What we have to do is that we should have a quality pulse oximeter with you. In a resting patient, you take the reading SpO2 first value. Then you ask the patient to walk around for 6 minutes at a speed which he is comfortable with. So after 6 minutes, you call back the patient and you are taking the reading once again. So in a normal patient, if the lung parenchyma is full normal, when lung parenchyma is there for gas exchange, the SpO2 reading of the first value and after exercise, it will be of more or less the same. Any fall more than 3 or 4 indicates that the full parenchyma is not there for gas exchange. So in a COVID positive patient, the first differential diagnosis for a lung parenchymal involvement, a decrease in cardiorespiratory reserve during exercise, the first diagnosis is COVID pneumonia. So it is a very simple clinical test by which we can easily predict the COVID positive patient for the chance of ongoing pneumonia, so that we can subject the patient to the sophisticated tests like CT scan and D-dimer or something like that. So the catch of this is that we are not delaying the treatment, especially the steroid therapy has to be started at the earliest. Thank you for watching, and please don't hesitate to share and subscribe my channel. This is Dr. Zakir Hussain, a consultant in anesthesia and critical care, Government Hospital, Tamirshiri.